Hello everyone. So now we are going to learn what to learn in the topic of enzymes. Always remember, learn the essay topics first, then only go to other topics. In the topic of enzymes, the essay questions that you can get is number 1 is the classification of enzyme. Remember, always learn it with an example. At least 1 or 2 examples you have to write. Then factors affecting enzyme activity. Always remember, draw the diagrams. It is very important. So draw the diagrams. Enzyme inhibitions. That is also very important topic where enzyme inhibition also please draw the diagrams. Regulation of enzyme activity that you have to learn. Then the next essay question is the isoenzymes where you can get the clinical utility of the isoenzymes. Then the enzyme profile in liver disease. It is again a scenario based question or a direct question to you. Then cardiac biomarker. That can also be a scenario based question where a patient of MI is given to you and asked about cardiac biomarkers. Then coming to the short answer question, the coenzymes. That is an important short answer question, and the cofactors. Then coming to any questions which I have already told you as an essay can be asked as a any subtopics or any short portions in that essay topic can be asked as a short answer question as well. So that is it. Then active site, it is again a short answer question for you. Km value and its significance. So whenever you are writing the Km value, please draw the diagram of the velocity of the enzyme activity against the substrate concentration and that diagram, how to find that Km value. Please draw that diagram. Then you mark that Km value and then you write the significance of the Km value. Then LDH, it's again an isoenzyme topic where you have to write about LDH. It can be a short answer question to you. Then enzyme as diagnostic reagents, which are the uricase enzyme, cholesterol oxidase enzyme. These are some enzymes which can be used as a diagnostic reagents. And then therapeutic enzymes, streptokinase, urokinase, all these are therapeutic enzymes where we are using the enzymes as drugs. Again, it is a short answer question. Now, which are the scenarios that you can get? First is the myocardial infarction, and from there you can go to cardiac biomarkers. Any type of jaundice, it can be obstructive, prehepatic or hepatic jaundice, where this goes to enzymes of the liver disease or to the liver function test. Then pancreatitis, not very commonly asked, but still I am saying a case of pancreatitis, and from there it can go to the markers of enzyme in the pancreas, but that is also not a very commonly asked question. It should not be asked as an essay question. Most probably it will be a short answer question. Then muscular dystrophy, a case of muscular dystrophy, going to the markers of muscle enzyme markers. And then very important thing that every time the students make a mistake is regulation of enzyme activity and enzyme inhibition. What to write? So under the regulation of enzyme activity, you have to write induction and repression, then degradation of enzymes, allosteric regulation, covalent modification, compartmentalization. These are the topics that you have to write under regulation of enzyme activity. Then enzyme inhibition, there you should not write anything about regulation because these two are two different entities. So enzyme inhibition topic you have to write about competitive, non-competitive, uncompetitive, feedback and the allosteric regulation. So this is what you have to learn in the topic of enzymes. Thank you.